In this video, I'm going to show you how to fix a crooked pelvis with a very unique exercise that you probably have not seen before. Stay tuned. Hey everyone, Dr. Rowe here at SpineCare in St. Joseph, Michigan. So one of the biggest problems of pelvic unbalancing is a sacroiliac or SI joint dysfunction. If you're unfamiliar with the SI joint, it's the union of the ilium of the pelvis with the sacrum. It's responsible for a lot of movement, especially leaning forward from the low back and twisting motion. So think if you've ever vacuumed, raked, anything like that where you're leaning forward and twisting, that's going to put motion into that SI joint. So if you have abnormal movement in that joint, it can affect your posture. It can make you have this overwhelming feeling that your hips are not in balance, like you have one leg higher than the other. It just affects everything down there, soft tissue, muscles, you name it. So with this one, we're going to do a self-release, self-crack, self-pop, whatever you want to call it, into the SI joint to help restore motion in there, hopefully loosen up all of that soft tissue around that joint and make it feel like your pelvis is more level and not crooked. So let's get started with it. So before we start this exercise, let's take a look at the overall alignment of the pelvis and the sacrum. So I'm going to take my thumbs, I'm going to go on the small of the low back right here and roll around until I find two large bumps. They should feel like little mini mounds. At that point, put our thumbs right on the top of those and go next to a mirror or have somebody around you take a look at that, where your thumbs are at. Does it look pretty level? Is one side tilted up a little bit more? These are going to be things that we want to note before the exercise, because afterwards, if it levels it off, we know that it is going to help with that SI joint dysfunction. So how we're going to find the contact point of the SI joint is go a little bit lower than where we were just feeling and go off to the sides. Bend forward and then twist to one side. You should feel a large joint through there start to move. At that point, we want to be over just a little bit on the outside of that. So when I do this exercise, you're going to notice my hand is kind of like this. I'm off to the side of that SI joint, and that's going to be my contact point to get that self-adjustment to fix that crooked pelvis. I'm going to break this up into a very easy step-by-step guide. First, we're going to do this on an elevated flat surface. A bed is perfect. If you do feel like you're going to fall off, I would probably not recommend doing this. If you feel more comfortable, put some pillows or a large comforter off to the side. So whatever side feels locked up or it feels like you're having the dysfunction into that sacroiliac joint is going to be the side that we're going to put up towards the ceiling. So just lay on your side. Whatever side needs to be adjusted, hip is up towards the ceiling. So this is how we're going to do it. The side that is on top, we're going to lift that leg up slightly and then we're going to bend that knee at 90 degrees. I'm going to take my hand on the opposite side, so in this case it's the left, and I'm going to grab behind the knee. From there, I'm going to pull down at the knee to cause rotation into the lower back, the pelvis, the SI joint right in through here. Only go to, so you're going to keep doing this until you feel a very good stretch into the lower back and that SI joint. The next step is taking the other hand and placing it right over that contact point, over that SI joint that we were talking about earlier. I just put enough pressure in there to start to intensify this stretch. Don't try to force this by any means. While I do this, I'm going to then start to apply pressure into that contact point and then keep lowering my knee until I get a very deep stretch into that area. If this is locked up and is ready to go, you're going to feel a self-pop, a self-crack into that area. But again, if it releases through natural movement, that is totally fine. Don't try to force this by any means to get that crack. What I like to do is hold this for about 10 to 15 seconds. I then relax, and then I just simply repeat for 3 to 5 times. If you feel like the other side needs some attention, by all means, switch to the other side, do the same stretch. But afterwards, stand up and put your thumbs over those two spots that we did earlier and see if it helped level that crooked pelvis. If it still feels
So if it's not like this, but it's more level, we know that it's working at that point. But also notice less stiffness in the area, more just range of motion, less pain in the pelvis or around the SI joint. If you're starting to experience that, we know that this is working for you, and definitely it should help give you some relief. Give it a try. I hope it helps.
So if you liked the video and got a lot of relief, please show us your support by giving this video a like and maybe subscribing to our channel too. If you have any comments or questions, please leave them below and I'll get back to you as soon as I can. Thank you for watching.